It is well known that heart disease is the #1 cause of death in both men and women in America. Now, diabetes is also the 7th leading cause of death in the country. 7th, with more than 100 million people living with it or with pre-diabetes. So, doctor, what do people need to know?
So diabetes is another example of a chronic condition that is very common in the population, and that our daily actions influence whether we get it or not, and if we already have it, because for example, it runs in your family, you have genes that predispose you to it, your diet and exercise, your lifestyle can really have a huge impact on your diabetes control.
Now, can pregnancy put a woman at risk for developing diabetes? I've heard that question before.
Pregnant women are at risk of developing something called gestational diabetes, which is basically the development of diabetes while they're pregnant. While women are pregnant, there are many hormonal changes that occur, and they can unmask diabetes. So a woman who develops gestational diabetes or diabetes during pregnancy is more likely to develop real diabetes later on in life.
And what are some common circumstances that can put someone at risk for diabetes?
I think that excess weight is probably one of the key factors in this. When we have excess fatty tissue in our bodies, our hormones and metabolism change, and we basically have impaired sugar management in our body. That's what leads to diabetes.